Welcome to the recorded lecture on health technology. Healthy People Initiative has set nationwide health improvement priorities with the vision of supporting a society in which all people live long, healthy lives. Health information technology and health communication are recognized as integral parts of the implementation and success of Healthy People 2030. Efforts to achieve the Healthy People 2030 vision include building and integrating the public health IT infrastructure in conjunction with the nationwide health information network. The discipline of health informatics focuses on the use of health IT to create a society in which Healthy People 2030 vision of health and well-being for all members is realized. We will discuss principles of information literacy used to explore primary informational resources for health promotion and disease prevention in this lecture. Health informatics is both an interdisciplinary professional area of specialization and scientific discipline that integrates the health sciences, computer science, information science, and other analytical sciences with the goal of managing and communicating data, information, knowledge, and wisdom in the provision of health care for individuals, families, groups, and communities. Because health informatics deals with the aspects of healthcare delivery, a wide range of other analytic sciences are used in the practice of informatics. When analyzing the definition of health informatics, consider the following key points. As an interdisciplinary professional specialty, health informatics includes various health professions such as dentistry, medicine, and nursing. As a discipline, health informatics covers areas of health care such as public health, acute and chronic care, and consumer health. Within this definition, the provision of healthcare for individuals, families, groups, and communities includes not just the treatment of health problems and the use of preventative measures, but also the promotion of general well-being. Health, computer, and information science, as well as other analytical sciences, provide processes, tools, methods, and procedures used within the practice of health informatics, but these tools do not define the scope of practice. The scope of practice is defined by the data to wisdom continuum and the interactions and interrelationships between the mega concepts inherent in the model. Mega concepts are overarching structures that incorporate several overlapping and interrelated abstract concepts. For example, the term bird reflects a basic concept referring to a general sense to the many different types of birds. On the other hand, an example of a mega concept would include love, freedom, or happiness. Mega concepts are much more abstract and include several other basic concepts. Digital health literacy requires the synthesis of 1. Basic literacy, 2. Computer literacy, 3. Informational literacy, 4. Digital literacy, and 5. Health literacy. Basic literacy is more than the ability to read and write. It is formally defined as the ability to identify, understand, interpret, create, communicate, and compute using printed and written materials associated with varying contexts. Literacy involves a continuum of learning and enabling individuals to achieve their goals, to develop their knowledge and potential, and to participate fully in their community and wider society. Computer literacy encompasses contemporary skills for navigating and using computer applications such as search engines and operating systems. An understanding of foundational concepts of information technology that provides insight into the opportunities and limitations of social media and other information technologies, and intellectual capabilities such as applying information technology to actual problems and challenges of everyday life. Information literacy is defined as a set of integrated abilities encompassing the reflective discovery of information and understanding of how information is produced and valued, and the use of information in creating new knowledge and participating ethically in communities of learning. Interrelated aspects of digital health literacy include the technical competency to operate digital devices such as cameras, e-readers, smartphones, computers, tablets, video game consoles, and so on. This does not mean that one can pick up a new device and automatically be able to use it without direction. Rather, technical competency means one can learn to use the device effectively with the help of the owner's manual and a bit of trial and error. The conceptual knowledge to understand the interrelated functional of digital tools. The ability to use these devices to access, manipulate, evaluate, and apply data, information, knowledge, and wisdom in activities of daily living. The ability to use emotional intelligence in collaborating and communicating in the digital environment with others, and the ethical values and sense of community responsibility to use digital devices for the enjoyment and benefit of society. Advanced practice nurses incorporate each of the literacy skills discussed above to collect data and information to complete assessments, develop a plan using evidence-based interventions to meet the needs identified in the assessment, and use standardized measures to evaluate the effectiveness of these interventions. Finding high-quality data and information begins by identifying the scope and organization of the information desired, both of which inform where and how to search for data and information resources. When considering health promotion and disease prevention, 3 factors can be used to determine the scope and organization of the resources of interest. 1, the concepts of health promotion and disease prevention. 2, the determinants of health. And 3, the concept of client. Information resources for each of the levels of prevention are not usually organized by levels of prevention, but instead of terms of specific diseases. Health information is also rarely organized around specific interventions because any one intervention might be used at any point in the continuum. For example, exercise might be used to promote well-being to prevent heart disease as a screening technique for heart disease or part of the cardiac rehabilitation program. Specific chronic disease prevention programs are organized by disease that can be used by advanced practice nurses in assessing risk and preventing a wide range of health problems. The second factor that influences the organization of health promotion and disease prevention resources is the identification of factors that determine health status. Almost every characteristic of a society can have an impact on the health of its citizens and can therefore be considered a health determinant. Because everything in a society could be a health determinant, as per Healthy People 2030, social determinants of health are the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. The Census Bureau, which attempts to count every U.S. resident every 10 years, is the most important source of population data. As part of their work gathering population data, they collect several data elements that help determine a population's overall health status and track the determinants of health identified by Healthy People 2030. The Census Bureau statistics are organized by topic. These include disability, expenses and investments, fertility, health insurance, HIV or AIDS status, as well as small area health insurance estimates. An electronic health record is an electronic version of a patient's medical history that is maintained by the provider over time and may include all the key administrative clinical data relevant to that person's care under a particular provider. The EHR automates access to information and has the potential to streamline the clinician's workflow. The EHR also has the ability to support other care-related activities directly or indirectly through various interfaces, including evidence-based decision support, quality management, and outcomes reporting. EHRs are the next step in the continued progress of healthcare that can strengthen the relationship between patients and clinicians. The data and the timeliness and availability of it will enable providers to make better decisions and provide better care. In 2009, the Health Information Technology for Economic and Clinical Health, or the HITECH Act, passed. The HITECH Act of 2009 was enacted under President Obama. The HITECH Act, 1, financially incentivized health providers to adopt EHRs, 2, achieved meaningful use of these EHRs, and 3, supported the exchange of health information. The concept of meaningful use rested on the 5 pillars of health outcome policy priorities, which include improve quality, safety, and efficiency and reduce health disparities, engage patients and families in their health, improve care coordination, improve population and public health, ensure adequate privacy and security protection for health information. In implementing the HITECH Act, the federal government determined that improving health care delivery required changes in providers' behavior and methods of practice. The Meaningful Use Program, administered through the Centers for Medicare and Medicaid Services, in cooperation with the ONC, provides monetary incentives for eligible providers and eligible entities who effectively use EHRs in providing patient care. The HITECH Act defines an EP as a doctor of medicine or osteopathy legally authorized to practice medicine and surgery, a doctor of dental surgery, a doctor of pediatric medicine, a doctor of optometry, or a chiropractic. EEs include all licensed hospitals that are reimbursed based on the prospective payment system and critical access hospitals. To obtain Medicare payments, the EP or entity is required to meet MU criteria for certified EHRs. The MU program is implemented in 3 stages, with the EP or the EE required to demonstrate specific measurable criteria based on 9 MU objectives to receive the monetary incentives. The 3-stage MU objectives include the following. 1. Protection of patient health information. 2. Clinical decision support. 3. Computerized provider order entry. 4. Electronic prescribing. 5. Health information exchange. 6. Patient-specific education. 7. Medication reconciliation. 8. Patient access to health information. And 9. Public health reporting. Stage 3, the final phase for the MU incentive program, is the process of being replaced by the Medicare Access and Children's Health Insurance Program Reauthorization Act of 2015. The legislation includes the Quality Payment Program, thus making significant changes in how Medicare pays health care providers. In contrast to the HITECH Act, in this legislation, a healthcare provider is defined as a physician, physician's assistant, nurse practitioner, clinical nurse specialist, or certified and registered nurse anesthetist. The legislation provides meaningful support for and progress toward paying healthcare providers for value or the quality of care provided and not the volume of care provided. Telehealth, sometimes called telemedicine, is the use of electronic information and telecommunication technologies to provide care when you and the doctor are not in the same place at the same time. If you have a phone or device with internet access, you already have everything you need to get medical care or services through telehealth. Telehealth includes mHealth, telemedicine, remote patient monitoring, as well as telehealth education. mHealth, or mobile health, is defined as the practice of medicine and healthcare over mobile devices, tablets, PDAs, or computers. This is a rapidly growing sector of healthcare. It is estimated by 2027 that there will be over $311 billion spent on mobile health markets. The major challenge of using mobile health apps includes the varying quality. There is no requirements to meet with the FDA standards, and that there are 5 different approaches to ensure safe medical apps. mHealth solutions are improving outcomes in measurable, repeatable ways by connecting patients with their doctors. Finally, it is important to note that mHealth apps are creating a two-way street between EHRs and personal health records. So here are the 3 most recognizable mobile health applications. This is by all means not the most comprehensive list, and there are many more out there. However, mobile MIM is the first medical app ever to be included in the iTunes stores. Mobile MIM is designed to share images from radiology, oncology, nuclear medicine, neuroimaging, and cardiac imaging. The health app is intended to enhance physical access to image scans to help them with consults with peers on challenging cases, reducing image distribution delays, and sharing images with referring physicians, partnering institutions, as well as the patients. AliveCore turns your smartphone into an electrocardiogram by snapping onto the back of any iPhone. To take cardiac measurements, the user presses the device against the skin found near the heart. The device has received much recognition for its mobility and the anticipation of capability to catch irregular heart rhythms earlier. Diabetes Manager by WellDoc works by capturing blood glucose information and transmitting it in real time. WellDoc's system analyzes the data and offers a personalized coach to help patients manage their medication and treatments. It also promotes interaction between healthcare professionals and patients by assessing where users need the most help. Telemedicine is the practice of medicine using technology to deliver healthcare at a distance. A physician, nurse practitioner, or physician assistant in one location uses a telecommunications infrastructure to deliver care to a patient at a distant site. One example is in the intensive care unit that has cameras in the room, so specialty care that may not be available in the hospital, such as neurologists, can provide and assess the patient, access patient data such as recent labs, vital signs, as well as imaging results, and speak to the nurse or other providers, all from a remote location. Remote patient monitoring is a method of healthcare delivery that uses the latest advances in information technology to gather patient data outside of the traditional healthcare settings. Some examples include glucose meters for patients with diabetes, heart rate or blood pressure monitors, continuous surveillance monitors that can locate patients with conditions like dementia and alert healthcare professionals of an event like a fall, remote infertility treatment and monitoring, as well as caloric intake or diet logging programs. Telehealth allows healthcare providers to overcome barriers to patient education. Health apps are application programs that offer health-related services for smartphones and tablet PCs. FastStats is an official free application from the Centers for Disease Control and Prevention's National Center for Health Statistics. This app provides selected statistics on a variety of health topics. Professionals are now even using Twitter to share informational web resources and to influence healthcare policy in this country. Here is one example of an educational Twitter post. The primary difference between a PHR and an EHR is that the patient owns and controls the PHR, while the EHR is owned by the healthcare provider or institution. Patients have a legal right to access most EHR data, even though the system itself is purchased and managed by the provider. Most healthcare providers establish a procedure through which patients can access data maintained in select sections of the ER. One of the most common methods is the use of a patient portal. Patient portals often provide secure messaging with healthcare providers, medication refills, and appointment scheduling, along with limited access to the EHR that can be served as a tethered PHR. The example of the PHR is the Blue Button Initiative. The Blue Button Initiative, which originated at the Veterans Administration, is the beginning of such a system. The blue button is a standard symbol on a patient portal that the patient can click to download his or her own EHR security. Via the Blue Button Pledge program, more than 450 organizations are providing Americans with access to their personal health data. The ONC maintains a website that provides a search function to determine if your healthcare provider or service participates in the program. One main disadvantage to the Blue Button Initiative, however, is linkage of the tethered PHR to only one specific healthcare provider or system only. Thank you so much for listening to the recorded lecture. Here are the references for the information provided.